Remember, the content on our show is for information only.
It is not intended to provide medical or other professional advice. Hi, and welcome to Placebo, the podcast where each week we review and discuss healthcare articles and news. I'm Kaylin Richards, and this is my brother.
I'm Logan Richards.
So this week we're going to be a little bit political, but not too much. But we're going to talk about healthcare, which has been in the news from a political standpoint, and we're going to look at that.
Don't we talk about healthcare every week?
Healthcare systems, I guess, or how healthcare is paid for, potentially.
Oh, okay.
Okay. So I guess we should just say very, very, very briefly, I guess the U.S. healthcare system is in a bit of a transition period, perhaps, right now.
I've heard that, yes.
What have you heard?
I've heard that it's in transition period. That's what I said.
So there's kind of a lot going on in the U.S. healthcare system. We have Medicare and Medicaid, which is, government paid insurance for people either on disability or that are above the age of 65. And then we also have private insurance, and then people that have combinations of both of those things. Like I know our grandparents, for example, have private insurance plus Medicare because Medicare doesn't cover everything, like drug prescriptions, for example.
Sure.
So there's also the Affordable Care Act, or Obamacare, which I think doesn't seem likely to last much longer.
Yeah, didn't they already do something to change it or alter it in one way or another?
Well, sort of. Again, to be brief, and what I understand is the Republicans who are in control now of the House and the Senate and the presidency would like to repeal, and then they've newly added on replace, I think, in answer to people's concerns that if they just repealed it and then didn't put anything in, there would be a big hole in the insurance field, and a lot of people would lose their insurance.
Sure.
So I think they've been saying that they will repeal and replace it, and there's been various politicians saying different things. President Trump says that he would like to repeal and replace it almost simultaneously, although I don't think anyone has really said what the replacement plan will be in any sort of detail at all. So I don't really know. We can't really talk about what the new idea might be, except for that he has said that he wants health care for everyone.
Well, that makes sense.
Which is great. And if I think former President Obama said in his farewell speech that if it can be done better and with less cost than the Affordable Care Act, he would totally support that. And so would I. I think healthcare for everyone is a great thing and should be the reality.
Right.
Yeah.
Another reason that I'm interested in this conversation is that there's an interesting gap in my knowledge from what I've learned from school, and that is how healthcare is actually paid for. Now, it's a pretty common thing that like PT schools often leave out business type topics. Like that's a common downfall that now, like physical therapy professionals will say, like, what do we wish we learned in PT school?
And I would say I don't remember learning a lot about the economic side of healthcare at all in occupational therapy school either.
Yeah. But even more broader than like how to start a business or like what kind of things matter in like running, the economics of PT or healthcare in general. Like I really have, it's kind of funny to think about it. I have almost no knowledge of, besides things that you hear in the news or things that I may have read on my own, I have no knowledge of how the healthcare, payment system works. How do I play into it? I have this vague knowledge of what you said, like there's insurance and some of it's private and some of it's Medicare or Medicaid, but the differences between all those things are very
confusing,
blurry for me.
Yeah.
Like I don't like. If you were to ask me, I would have a hard time telling you the difference. So that's one reason that I'm interested in all this, because I feel like they don't teach you about it. And maybe it's because it's hard to teach because it's always changing. I think it's very
complicated and changing. And I think maybe this is why people have such strong and varied opinions on healthcare, is that I think people have their personal experience of healthcare, and it's really hard to understand the the whole system
Yeah.
because it is so large and so varied, and there's so many parts coming in. Because, like, for example, with the Obamacare, some people like it and would like it to stay, and some people think it's, bad and was, like, causing them to pay more for health care. And that's a big part of, like, perception, right? Maybe of their specific plan that they were on, or their specific case, or their political beliefs. I don't know. But it's such a hard to pin down topic.
Yeah. So will you just define these things before we start?
Okay.
So Medicare.
Yeah.
That's federal?
I think it's federal because it's for all adults.
Okay. And that's like over 65?
Over 65.
And what, do you have to be retired, or does everyone get it?
No, just
or?
once you're 65. You have to register for it. You don't just automatically get it if you don't do anything.
For some reason you didn't need it and didn't want to register for it.
Yeah.
What's the downside for registering for it? Do you have to, like, pay money, or are you not getting money that you've previously paid into the system somehow? Or?
I don't know. I know some people keep two types of insurance. They'll get the Medicare, but say they're still working, or they have a spouse that's still working, or they have other access to private health care. They'll take both because you get better coverage.
Yeah.
Both. Medicaid is through the states. I do know that.
I was wondering about that. So Medicaid is a state-regulated
and controlled program.
Insurance, or what is it?
It's also insurance, like for health, to cover healthcare expenses for people generally with disabilities, also like that are under 65.
Okay. So you have to, again, probably somehow prove that you need this type of Medicare.
Yeah, you have to prove that you qualify by documenting your disability. And also,
is it free for you at that point?
I don't know. That's a great question. Okay. I don't know. I do know that because it's by state, it can be problematic if, for example, someone who's on Medicare or Medicaid moves or is in a different state and they need health care. Anyways.
So we still don't know exactly like what the benefits of having Medicaid would be. I assume that it's cheaper.
Well, part of the problem is if you're disabled, probably you can't work. And so it's taking the place of the insurance that your employer would pay. Okay.
And then there's private insurance, which is, for most people, offered to you by your place of employment, I guess?
In the U.S., yeah. And we're all talking about the U.S. here.
Well, obviously.
Yeah. So, yeah. For most people, it's offered through your parents. If you're under 26, I think, right now, although I believe that's part of the Affordable Care Act, so that might change.
Okay.
And then, because it used to be younger than that, I think, or through your employer.
And what's the advantage of that? Like, I don't understand how we got there.
What? What's the insurance?
Why private insurance is only available through employers? And, because...
Yeah, I don't know. I know that that's not the way it is in other countries.
Because when the Affordable Care Act started, right, it was a big deal that, like, there was these healthcare exchanges where you could basically buy private insurance. Isn't that what it is?
You can buy insurance that's then not associated. Because previously there was other private insurances that you could buy. I think Cobra was the name of a type of insurance. So, for example, if you quit a job and you had a new job and it was starting in 3 months after you quit your previous job, something like that, or you were laid off and you had some time, you would have some coverage through your previous job, but then once that was off, you would either lose coverage entirely or you could pay for Cobra, which would be a very basic, like usually like emergency care type stuff.
Is that like a company or something? Or
no, it was through the government as well, I think, but it's very expensive and it only covers like very, not your normal like, I need to go to the doctor and get antibiotics or whatever. So
I guess the point we're trying to make is that there's so many random like divisions of types of healthcare and ways to get healthcare that it doesn't make, even to someone who works in healthcare or who is very involved in healthcare, it doesn't make any sense.
And like I said, and you said as well, like this is not something that was taught to us really in school. This is something that we've tried to figure out through our own experience. And I just the only thing I would add is working in healthcare, it's just made me more and more frustrated at the high costs to patients and families. It's so sad to me to see people so stressed about being able to pay for healthcare that they need. And then it's also sad to me, I see since I've become an occupational therapist, which has been 6-ish years around now, I would say it's become much more difficult to get insurance companies to pay for like rehab services, like what we do.
Which is why all the inpatient rehab units are closing everywhere.
Some are closing, yeah. And I would say, from my perspective, that's short-sighted because I would believe that if people get better rehab initially, even though that might be more expensive up front, they're going to need less assistance and less care and less, input later on down the road.
Well, that's that huge point for universal healthcare, that if we care for everyone like we should, then that will have greater influences on things like socially and economically outside of healthcare, right?
I can't remember which article it was now, unfortunately, because I read a whole bunch of different small things to research for today's show. One doctor was talking about how the focus in healthcare for a long time was on like kind of the catastrophic, like hospital stuff, surgery stuff, like the major, this is going to change your life right away type stuff.
Yeah.
Because that was all that we could do. Because, you could give someone a surgery and take out their appendix or something. But we didn't know how to do a lot of the smaller things that make people's life better. Like his example was blood pressure. For a long time, they didn't know that people had a problem with having like high blood pressure.
Okay.
And they didn't have a way to control it when they found out that they did. And so finding out that this is something that should be monitored and this is something that should be controlled saves a lot of other healthcare problems, like having a stroke later on because you have high blood pressure.
Right.
So his point was that there's been a focus on like this high acuity type medicine at the expense of like primary care, perhaps, which is maybe where more of our focus should be going more and more nowadays.
Right. That makes sense to me.
I wish I remembered where I read that. It made a lot of sense to me.
Well, so I think we've thoroughly addressed that we have no idea how healthcare even happens in this country right now, and we certainly don't know how it will happen in the future.
So I want to talk a little bit about healthcare in other countries, just to give some other examples, because, like I said, I would love healthcare for all at a lower cost than we currently pay. And, I mean, that does exist in other countries. So
well, I think we all would. Everybody
even
President
would, right?
Trump is saying that.
Right, because who wouldn't want that? That's a wonderful goal. So I looked at a couple different articles about healthcare in other countries. This one is from, I haven't heard of this website. Do you know this website, Mike.com? I looked at it. It said it's a news website focused on looking at things from different angles or something like that.
Sounds fake.
The article is written by someone who is a student, which, I wish they were not a student. That doesn't seem like the most expert person, but
newly educated.
Maybe there you go. They're studying Georgetown University, international political economics. So it's in their field anyways.
It is interesting when you first search this that it comes
This is
up
the number one article
on the
that
top
came
of
up.
Google.
Yeah. So
makes you wonder how that happened.
It basically starts out by talking about a little bit Obamacare, or the Affordable Care Act, talking about why people don't like it. And this article was written in 2013 and starts out with a quote from Jeff Sessions, who is now up for Attorney General.
I don't know.
I think that's right. Attorney General. So they're talking about, the world, at the time this article was written, the World Health Organization ranked American healthcare as 37th. And the Commonwealth Fund ranked America's healthcare system last on the basis of 12 factors that they rate countries on. So why are other countries so far ahead of the U.S.? Why do they have lower healthcare costs? Because most of them do, and that's kind of why we're lower in the rankings, because our healthcare costs are so high with not good payout, I guess. So they have 7 countries in here.
I would guess it's because we don't eat very well. We don't exercise enough, and like you were saying earlier, we spend a bunch of money at the end of life and almost no money, in the in-between times when most people nowadays would say, I don't need any health care, but maybe that's when you actually could spend a small amount on something preventative or... that nature and then save
Yeah.
a lot of money in the long run. That's what I guess.
I think those are good guesses. That's not what this article talks about, though.
Yeah, well,
This article talks
maybe I'll
about
write an
just
article.
kind of the healthcare systems and how they are different. So,
well, I partially mentioned that.
yeah, okay. So basically, there's Australia. So
That's it. Australia.
Australia. So they have public coverage guaranteed to all, as it says. But the state, the government encourages people that are more wealthy to use a private system by giving an additional 1% tax on all those who are above a certain income level, but choose to use the public system.
Isn't that interesting?
Yeah. So it says they have, I don't know exactly what the statistic is, but they said that Australia's death rate from conditions amenable to medical care, which maybe you're talking about like heart disease or things like that, right? Maybe related to activity level and diet.
Something preventable, I guess.
Was 50% less than America in 2003 and 25% less than the UK.
Okay.
UK is also on this list, though, and we'll get to that.
I have heard they have government health care there, too.
There's also Sweden.
Oh.
They said that Sweden's healthcare expenditures in 2011 were estimated to be maybe around US dollars $5,331 US.
Like that's all they spent on everyone?
Per person, per capita.
Okay.
Sorry. I forgot that ending part of the sentence.
No one's getting sick in Sweden.
That's it. That's all they pay.
Or everyone is dead.
So they said part of the reason they think that might be so low, though, per capita, it's still pretty low, considering that includes like elderly people, right?
I guess. I
Yeah.
honestly have no idea what the number would be here. So
Let's do a little Google search. Healthcare expenditure per capita U.S.
I would say that that's significantly more than I spend on healthcare per year.
In 2014, according to the World Bank, it was $9,403 for the U.S. So about double-ish the cost it is in Sweden.
Yeah. Okay.
So they said
Because less people are getting healthcare, or
well, they said
they
part
just
of it
don't need it.
they think is that they disincentivize sending patients to specialists when their illnesses can be treated by general practitioners, so they reduce costs that way.
okay.
I
How do
think
they do that?
they say disincentivize, so I would guess there would be monetary penalties for sending someone on to a specialist when it's not needed, perhaps.
Okay.
I would say in the U.S., in the hospital system, there's a tendency to get more and more and more people involved. That's kind of
Right.
what our system supports, I think.
It's interesting
Because you don't want to not do something, right?
Yeah, well, and that is something that they definitely teach in school, that
Mm-hmm.
you should absolutely get more and more and more providers involved and know how to work with all the different providers who might be involved in someone's care. So that is, they're saying that that's actually a more costly strategy?
It's more costly, yes, to
At
have
least
more
in
people
Sweden
involved.
it would be. That,
Yeah.
I mean, that makes sense, right? The more people that...
Yeah. So, and we have France, another system there that really provides most healthcare coverage for everybody. So in France, about 80% of their healthcare spending is covered by the government. 20%, the remainder is covered by insurance plans through employers.
Okay.
So it's kind of similar to the U.S., except for way more funding comes from the government, right, for everybody.
I guess so.
Okay. It says, I don't know if there's been any changes since there's a lot of controversy about this in Europe right now, but it says every citizen in France is entitled to this public coverage, including illegal immigrants, which is interesting. In the United Kingdom, they have the National Health Service, the NHS,
Right.
which is publicly covering costs, including preventative services and mental health care, which is interesting, as well as most prescriptions. So,
Aren't there a lot of like private, private hospitals in
the UK?
Yeah.
So I know, and it may be similar to what they mentioned for Australia, where you could choose to pay for private services.
Yeah.
I think in the UK, and I think in Germany, which we'll get to in a second here, you can choose to pay for private services if you want and get maybe quicker services. There might be wait times for some things, or you get to stay in a nicer hospital or a private room in the hospital versus a shared room, that sort of thing.
Okay.
I think I've shared before on the podcast, maybe when I was in London and I went into a hospital, they had beds that were like 10 to a room.
Yeah, which is, of course, very unhealthy, we know.
Well, but they're spending less on healthcare. I don't know.
But are they in the long term? If everyone's getting the same infection in that one room or something?
Anyways, that's 10 beds in a room. People wouldn't like that very much here. They complain with 2 beds per room. But when you're not paying for it or paying very little. So in Germany, which I mentioned coming up, so 90% of people use the public healthcare system there, and then 10% voluntarily uses the private system, probably people that are more wealthy and then just want to pay for the maybe nicer service.
Okay.
I have a Quora answer here from someone who's describing the German healthcare system, just from a citizen's perspective, I guess.
Yeah.
And they talk about how when you get like dental work, like from the public system, you're just going to get like the most basic kind of like tooth repair, say, for example, if you chipped a tooth, versus you want like the fancier materials or to get color matched just right, you're going to have to pay more. They talked about having a private hospital room versus a shared room. That's kind of the differences.
In terms of public versus private pay?
Yes.
Okay.
Yeah. They said the public plans, you can't refuse anybody. Public plans also cover all non-working family members. Like if you have 1 kid or 5 kids or a spouse that doesn't work or whatever, it's one fee that's the same no matter how many people are additionally covered.
Well, that sounds pretty similar to the way that the UK does it then. Maybe their numbers are a little different, but
yeah,
you get this basic health care that everyone seems to get, and then you can pay for more if that's what you're interested in paying for.
So the Canadian system, and I realize we're just talking about the very little details about each system because they're all probably complicated just like the U.S.
Yeah.
It has a national healthcare system like in the UK, and it has a centralized controlling body that sets the standards that all the provinces must follow in order to receive funding. So if they don't follow the standards, they don't get funded.
Okay.
And then hospitals are usually private, not nonprofit, and then they have to get their funding, though, through following the standards that the government sets.
That makes sense.
Yeah.
Now, I know for sure that there's like a wait time issue with healthcare in Canada.
Mm-hmm. And I've heard that with the UK as well.
I assume that wait time is an issue with all of these ones where a larger portion of the population has this universal healthcare or whatever you want to call it.
You're talking about people being maybe in line or lines to see the doctors for certain procedures. In this discussion of the Netherlands, where they have a system which might be a little bit common to the Affordable Care Act or Obamacare, they have insurance is mandatory. Everyone has to have it, but it's provided through private insurers which compete on the open market.
Okay.
So that kind of sounds like the Affordable Care Act to me, like
sort of. Yeah, it does.
Yeah. So insurers can decide how they want to, set up their systems, how their beneficiaries get their services, or who they can get them through.
Okay.
So you can kind of decide what works best for you. Anyways, they talk about how in 2010 they found that 72% of Dutch adults saw their doctor the next day or the same day when they were sick, compared to 57% of adults in America.
That sounds pretty good.
In their system, anyways. So they don't talk about how their system is funded there, so I don't know.
Privately.
But is it through insurers employers, or is the government funding part of it, or?
I don't know.
Doesn't say. I'm sure we could find that out. But so could our listeners. Google it.
Is it kind of like a supply and demand thing? Maybe for Canada and the US, or Canada and the UK, they don't have enough doctors or healthcare people in general in order to manage everyone because everyone has healthcare? Or everyone is entitled to healthcare in those places?
Maybe there's a shortage of healthcare professionals. Maybe...
Because we already have that kind of shortage here, even though we have whatever weird system we have.
To talk a little bit about politics, maybe I was listening to something where they were talking about jobs reports, and how the jobs reports have shown that there are lots of new jobs. There are, jobs growth every month or whatever.
Sure.
But people then say that, my job has been eliminated, there's been layoffs, whatever. But I think what this report was saying is that a lot of the jobs the jobs that are being created, or the newer jobs, a lot of them are in healthcare. And maybe a lot of people whose jobs were eliminated in manufacturing or coal mining or things like that are not trained, or maybe not interested in working in the healthcare field. So that's partly why there might be a shortage in the U.S., not enough trained people to work in the positions that are available.
That makes sense. The other thing I'm wondering is that, like, I've also heard that healthcare workers get paid some percentage less than like, say, a doctor in Canada versus a doctor in the U.S.
You mean a doctor in Canada gets paid less?
Much less. And
Probably,
I've also heard that
true.
with physical therapists. Like, if you compared the salary of a physical therapist in Seattle versus Vancouver, BC, which are relatively close cities, the PT in Vancouver gets paid about half as much if you account for the change in currency.
I wonder if they don't have student loan debt. Wonder what that's getting into their student.
But there's so much interesting because
system,
like right now there's a bunch of controversy in like the physical therapy world about like this weird thing that you just mentioned, where like we have to pay a lot for the degree, but the amount that you get paid after doesn't seem to make up for that.
I think that's the case even for doctors here in the U.S. A lot of them go very deeply into debt because medical school is long, and then you don't get paid much at all at first.
So does that mean, I mean, I'm sure it's a combination of like the education is too expensive for whatever reason, but also does that mean that the healthcare providers aren't getting compensated enough for what they do?
In these countries? We're getting into more questions that I can't answer. Yeah. I don't know. It's a very complicated topic, and we're not going to be able to answer all the questions.
I think that debate is probably going on in most like different healthcare professions, that right now in America the cost to entry is so high, and we have supposedly this huge like debt of people that we need to fill all these healthcare jobs.
Mm-hmm. There's always jobs open.
But you have to pay so much to get in order to be eligible for a healthcare job, and then you might not make enough to pay off that debt once you get that healthcare job. It's a very interesting situation we have now.
And I don't have the solution. I don't think anyone has the solution.
No.
I think it maybe is something that can be worked out over time with people working together, people.
I've never once heard of that. Okay, well, what do you think we should do? It was fun to hear about all the different types of universal type healthcares.
What do I think? What's my idea?
Yeah, what do you think we should do?
I don't know. I really like the idea of universal healthcare.
We already know for sure that we can't handle it if we
can't handle it. We can't handle it.
There's not enough not enough healthcare people.
Well, there would have to be maybe other programs as well. But I just feel like it's so sad. In 2017 now, we have the ability to provide healthcare. We just don't have the way to pay for it, and it's so sad that we can't. And it's just disappointing. I don't know. So I would be so happy, and maybe more people would be. I would say one big stressor of my job is if I recommend something for a patient as in their best interest from their health standpoint, for example, a lot of times it doesn't happen because it's not possible.
Yeah.
So that's a really big stressor in my job for me personally. And I think that maybe more people might be willing to enter the healthcare field if there were less stressors like that in it. I would say that's one of the most frustrating things for me.
It is interesting. The cost to enter a healthcare job is more than just financial.
Yes. You have to want to do it because it's not, you have to want to do it. You have to keep working at wanting to help people.
Yeah.
Yeah.
I don't know where that's going.
It's not a job for everybody. A lot of patients tell me, I can't ever see doing what you do. But I think it's a great job, and it gives you a lot of satisfaction too when you can help people.
Do you think if it was a job that was easier for more people to do, then it would cost less in general?
How do you mean that? Say it in a different way.
well, I'm not sure this analogy would work, but you brought up manufacturing. So a bunch of people, like, it used to be, right? You didn't have to have a college degree and you could work in some type of factory or whatever. And a lot of people did that.
And make a good living,
And make a good living.
Yeah.
So what if the cost to entry, like, was so low on a healthcare job where you could enter it without having to go to school for 100 years and pay $100,000?
Well, I think people could get into a healthcare
And
job
so there was,
as a CNA, for example.
And then there'd be a ton of healthcare people. And if there's a ton of healthcare people, does the whole system cost less? Or does it cost more?
If there's too many healthcare workers, then there starts being a shortage of jobs.
But there's plenty of people to
supply
care
and
for,
demand.
isn't there? If we have all these healthcare jobs being created.
We still have the problem of how they're being funded. There has to be enough pay to go around to all these healthcare providers.
I don't know.
See, it's a hard question. I'm very interested to see what the new healthcare plan might be. I don't know.
Me too.
I don't have a lot of hope, but I would like to see what the idea is.
Okay, well, that's all I've got.
That's all you got? Oh, I was going to say something more about the beginning about the current plan, but it doesn't matter. It's fine.
Okay.
Okay, well, I think that clearly we've solved all the problems.
Yeah, healthcare is solved.
Healthcare is solved, so Republican Party, President Trump,
Just
we're here.
listen to the podcast.
We're ready to help you.
Say, do what,
No.
which one do we like? Do what the Netherlands is doing.
Well, that's the one that's like Obamacare. I think they're not going to do that.
Oh, okay. Do what Sweden's doing.
Sweden, what is that one doing? I like France. They get those long lunch breaks and those short work weeks. How do they do that?
France has that far right person that might win president there too.
They still got short work weeks though.
How short is their work week?
How about Australia? They got nice weather.
Oh
beaches.
yeah, that one did sound good. That's the one
Yeah.
you started with.
Yeah.
That one sounded good.
Yeah, we might consider the Australian system.
Okay. All right. Well, if you enjoyed that episode, we will post links to some of the interesting pieces that we read in order to research for it on the description of the episode.
Or if you have any other thoughts about healthcare systems or things we didn't cover or you think covered wrong, no political rants, please, but we'd be interested in hearing other perspectives. Send us an email at placebopodcast@gmail.com.
Also, we have a Facebook, Placebo Podcast.
Yeah.
Thank you to James Aiken for our music.
All right, and we'll see you again.
And
Talk
thank
to
you to all of you for listening.
Oh, thank you to all of you for listening. Did I forget that?
Yeah.
I'm not looking at my script. We'll see you again. Talk to you again next week.
Bye.
Goodbye.